welcome to the Functionally Fit Physio. So today we're going to talk about the hip and how to check if your hip mobility or your range of movement is holding you back. Okay, so it's really important to know what the hip joint is. It's a ball and socket joint. So essentially your pelvis sits like this and the top of the thigh bone sits into the socket and it allows a really large amount of movement. So what are those movements? We've got hip flexion, hip extension, abduction, adduction, external rotation and internal rotation. Now because the nature of the joint is a ball and socket joint, even when we flex the hip, there will be some element of rotation. So if we have some restriction within our ability to rotate, so even if it's just a mild internal external rotation, then you may well find that there's some restriction in your flexion, extension, abduction and adduction. Of course, we can't talk about the hip without talking about the pelvis, although we're not going to go into the pelvis specifically today. But if you have any restrictions around the lower back or the front of the abs into the lower abdomen, then it may well be that things like sitting upright with the legs apart, or if you spend a lot of time in a chair sat in this position, that then changes the muscle lengths between the hips, so that then impacts on how the hips can move. So if you do have any restriction in the pelvis, you then may well feel it in the hips. But for today, we're just going to look at how to assess the hip movement. So how to check what your hip flexion is doing. So the best thing to do and the easiest thing to do is to lie on the floor and hook one leg in whilst straightening the other leg. So and this is the hip that we're going to be checking. So this is the hip flexor that we're checking. So we're going to hook the right leg in. Now it may well be that you can't place the hand in front. It may well be that you need to place the hand behind the knee. And what we're looking for is this hip and this leg. What does it do? So my leg is on the mat, but if you are experiencing hip flexion tightness, if your hip flexors are tight, this is what's going to happen. Or you're going to have to really rotate, pull through your lower back, and you might find that you can't straighten the leg, or the leg is lifted if you do try and straighten. Okay, so the same sort of thing on the other side. It's important to check both sides because it's often that we have one side maybe a little bit easier, a little bit more flexible, or a little bit more restricted. So then we know where we're starting off. Okay, so if we're checking hip flexion, this is the easiest tool to do it with. Now, if you find that they are stiff, if you find that they're tight, how do we correct it? Anything that involves extending the hip and also strengthening the glutes, okay? So we want a yin and a yang. We don't ever just want to stretch something, we want to lengthen and strengthen. So a really good example of this is a shoulder bridge. Place a block in between the knees and that just allows alignment to maintain. You start off in our neutral position, tilt the pelvis, and then you might find that even this position really pulls into the glutes, and then you're going to lift the back off the mat. Now you might find that if it's so stiff that you untie, you can't then actually extend all the way. But what it's about is lengthening, squeezing the glutes, so you're coming all the way up. The aim is to have a line running from the knees through the hips to the shoulders, and we're feeling a long position and that they're not dipped down. If that is the case, then it's just something worth practicing. Okay, another thing that you can do is hip flexion, tightness. So you would come into a lunge. And again, if this is particularly tight, what you may want to do is place the foot flat. Remember the front knee, don't let it roll in. So you want a good alignment here. This is the hip that we're focusing on. So you're going to just tuck it under and then push it back. And this may well be enough to lengthen and feel that stretch. And if you want a little bit more, you come forward and you're going to feel the stretch, not just into the hip flexors, but also the quads, so the front of the thigh. You can develop again by taking the hand up. So if this is your right leg, the right arm comes over the body, and this then speaks to the lower back and the outside of the hip. And release and back. a couple of things that you can start to do throughout your day or add into your normal routine to wake up those hip flexors and try and ease out that tightness. So, hip rotation, we're going to check. So hip rotation is internal and external rotation, okay? So what you might want to do, a really good tool, is sit 90-90. Now in this position, the pelvis, you do want it to be fairly level. Now that's a really good indicator of what's happening at the hips. So if you're unable to have a level pelvis and your hip is up like this, that already tells you that this hip has some restriction, and it may well be that you can't externally rotate through the hip to allow it to sit down. If this front knee is really high, it's likely that again the external rotation and your adduction, so the inner thigh is tight, so it's pulling it up into this position. Again, the pelvis will be playing a part in this as well, okay? But we're, for this video, just looking at the hips. So that's a good indication, so you would know. We turn it over on the other side, and again, if this leg, if you can't even get this leg down, it may well be that it's tight into internal rotation, and same on this side. So you want the hips, find the hip bones. If one side's really lifted, and you can tell if this hip, if this glute isn't on the mat, if you try and sit it down and it's agony or you just can't get it down, it's blocked, then you know there's a restriction in that hip, and that it's likely to be, if you can't sit down, external rotation, and you're probably a bit tight in the inner thigh, and you're a little bit probably weak in your glutes, okay? So what to do about it? A really good exercise is bring this leg a bit further forwards and come over the leg. So again, we always want to strengthen and lengthen. So this knee's going to stay bent, and you're going to lift the back knee and then lower it. So that's working on strengthening the glute. At the same time, we're trying to lengthen the inner thigh. You can add on where you lift and you push it back. So that's going to target the front of the leg, so your hip flexor and into the inner thigh, and back down. Come back up and down. And then finally, to work on internal rotation, you lift the leg up, so that works on here and into there. Good. Now if the pelvis is playing a part, a good way to check is to sit up in this position. And if you're sitting like this and your lower back, you can't tilt it forwards and you can't come up, sitting onto a block can help take some of the element away. But the inner thigh would also be playing a part. So how do you stretch when you've got a tight pelvis, lower back, inner thigh? Sit on a block, try and sit up, and that might well be enough. If you're sitting there and the knees are like this, bring the legs a little bit closer. And again, just get comfortable. I use the term loosely if you're pretty tight, in trying to work on coming forwards and then just gently ease back out. And you don't want to do it for hours and hours on end. It's all about functional movement. Good. And then you could bring one foot in and let that leg sink down. If you find that that's too much, if you've got a block or a rolled up towel or a cushion, support it. Again, lengthening up, letting that leg sit down. And then you would just bring it up and back down. If you remove the block, can you push it down and back up, push it down, and same on the other side. And you might find that one side is really tight, or it may be surprising that it's actually not that tight. And you come up and out, support and let it relax. Good, and then release. There's a couple of options there just to assess how your hips are and then where just your starting point is, and how then to correct some of the potential muscle imbalances. This isn't a comprehensive assessment, so it's just some tools for you if you have an inkling that something might be going on in the hip, to start to notice what might be causing any restrictions or any limitations. So if you feel like you want any further in-depth assessments, I would definitely advise going to see an in-face physiotherapist or a chiropractor, and just get that hands-on, the eyeballs on you, and then go away with some tools. I hope that you enjoyed this video, and I hope that it was helpful. I would really appreciate it if you could give it a little like and maybe subscribe to the channel just to support me and my business. And of course, come over to social media and have a little look at my my page